Picture this. It's just after midnight in steamy Shanghai. The air is thick, the kind of night where the pavement still sizzles. Suddenly, a violent rainstorm blows in, and, almost on cue, the ER doors swing open. One heart patient, then three, then a dozen. Doctors start asking, why now? Turns out Shanghai isn't alone. From Guangzhou to Harbin, physicians were noticing the same eerie rhythm: blistering heat, a sudden downpour, and waiting rooms quietly filling with people whose hearts had simply had enough. At first, it felt like coincidence, like a couple of bad traffic jams you chalk up to luck. But when researchers pulled together health records from nearly 2 million adults across 157 Chinese cities, a pattern snapped into focus. Here's the headline: extreme temperatures and heavy rain don't just add risk, they stack it. Think of them as two hands squeezing the same stress ball, your cardiovascular system, at the very same moment. First signpost: the pattern emerges. Scientists mapped every hospital visit for ischemic heart disease, stroke, heart failure, and rhythm problems. Each visit became a tiny dot. When the air turned odd, too hot, too cold, or drenched in rain, those dots clustered, not randomly, but predictably. Key point: it's the departure from what feels normal locally that matters. A 90-degree day in tropical Guangzhou is par for the course. A 90-degree scorcher in Harbin, much farther north, is a meteorological shock to the system. So the team set city-specific thresholds, then looked at what happened when weather leapt past them. Second signpost: the numbers speak. Each time temperatures overshot the usual local range, heart-related admissions ticked up a few percentage points. Layer on unusually intense rain, and the curve bent higher still. Same story across 157 cities. Millions of individual stories, one repeating chorus. Let that sink in for a second. Third signpost: who gets hit hardest? The burden does not fall evenly. People over 65, women, and anyone already living with hypertension or diabetes saw the sharpest jumps. Men still outnumbered women in absolute ER visits, but women's risk climbed faster as conditions worsened. Translation: the old, high-risk checklists may be too blunt for a world of weather whiplash. Fourth signpost: it's about now, not 2100. These are short-term spikes, hours to days after the weather swings, long before annual climate averages inch upward. So staying indoors on the single hottest afternoon won't fully solve it. The terrain itself is shifting under our feet, turning everyday errand running into a mini stress test for the heart. Micro story break. Imagine you're heading out for eggs and milk. 10 years ago, you scanned the forecast to dodge rain or sunburn. Today, that same forecast may quietly double as a medical alert for grandma, your diabetic neighbor, or even you. A string of sticky nights? Might be time to remind Dad to refill his prescription, charge his phone, and check in with his clinic before the next squall. Hospitals are starting to think the same way. Instead of bracing for one disaster day, cardiology wards can use high-resolution forecasts like airports use storm trackers, not to panic, but to pre-position staff, free up observation beds, and sync with ambulance teams before the surge hits. And it doesn't stop at hospital doors. Insurers, city planners, even employers can treat each unseasonal swing as a drill. Who gets robocalls? Who has backup cooling or heating? Which neighborhood clinic keeps late hours when buses stall in the rain? Fifth signpost: designing for a heart-smart climate. Normal care may need a climate setting. Picture your family doctor glancing at next week's forecast before scheduling your follow-up, just like a pilot tweaking a flight path around turbulence. Employers could lighten shifts when the mercury and humidity tag team. Neighbors might hop onto a group chat to share a spare fan, a cool basement, or a ride to a clinic. Bottom line, the study isn't only a warning, it's a design brief. If weather apps become early text alerts, they can trigger small rituals that save lives. Refill water jugs, adjust meds with a professional, check on someone who lives alone. Pause for breath. Before we wrap, let's make this personal. 3 quick questions for the coming week. 1. Where do you spend the hottest part of your day, and what simple tweak, earlier walk, shaded workspace, fan or AC, would protect your heart when the next heat wave strikes? 2. What's on your heart safety checklist for extreme weather? Staying hydrated? Checking blood pressure? Easing off heavy meals? Post it where you'll actually see it. 3. Who in your circle is most vulnerable? An older parent? A neighbor with diabetes? A friend with high blood pressure? How will you check in when forecasts turn weird? Let those ride shotgun in your mind. So here's what we covered today. First, ERs from Shanghai to Harbin spotted the same eerie combo. Blistering heat plus sudden downpours equals more heart emergencies. Second, a massive study of nearly 2 million adults confirmed the pattern. The farther local weather strays from normal, the steeper the rise in heart problems, especially when extreme heat or cold meets heavy rain. Third, risk isn't one size fits all. Older adults, women, and people with hypertension or diabetes shoulder the biggest jumps. Fourth, these are near-term spikes, not distant projections. Forecasts for tomorrow morning can be as important as climate models for 2050. Finally, that means action starts now. From hospitals pre-positioning staff, to employers adjusting shifts, to you and me setting up check-ins, stocking water, and knowing when to cool off or warm up. Here's the empowerment piece. You can't change tomorrow's weather, but you can change how ready you and your community are for it. Treat each strange forecast as a friendly nudge to tune up your heart defenses. Small moves today can keep those ER doors from swinging wide tomorrow night. Stay cool, stay prepared, and as always, take care of your heart.